Greetings, Christ women. I am here to talk to us quickly on our health. I am Dr. Rachel, and I want to use this medium to appreciate my daddy, my papa, and my mommy for this opportunity to speak to my sisters. I'm gonna go quickly because of the time limitation that I have, and I will be talking on cancer. Cancer because unlike other illnesses, hypertension, diabetes, malaria, we do have definitive treatment for them. Cancer, on the other hand, it's a growing body of research, and only a few cancers that we do have treatment for, but for the most part, early detection has been key. If they're detected early, it can be salvaged. Unfortunately, even for some cancer treatment, they end up causing even more harm. I'm sure you've seen some patients that are undergoing cancer treatment. They don't look good, their hair is falling off, they look frail, So anyway, I know we have women, this is a women conference, but we do have men here. So I want us to please listen attentively because it may not necessarily impact you, but this information or this awareness can help your friend, your sister. If you're a husband here, listen for your wife. If you're a brother here, listen for your sister. Let's not be selfish with the knowledge that we get. So there are several kinds of cancers. I'm just going to pick on a few. First of all is breast cancer. Now, breast cancer, unfortunately, is more common in black than white. So for women, breast cancer screening can be done from the ages of 40 with a test called mammogram. So mammogram is an ultrasound scan of the breast that's usually done in women from the ages of 40. But if you're less than 40, you can examine your breast yourself, a self-breast examination. Now, you're not doing this because you're trying to detect cancer. You most often cannot. But the self-breast examination helps you to familiarize yourself with your breasts, knowing what they look like, knowing what they feel like. So if there are any changes, you can raise alarm and go to get checked as soon as possible. And for women who are menstruating, it's recommended that you do them at least 5 days after your menstrual cycle. And that's because when you're undergoing menstruation, there are some changes that are physiologic to your breasts, and you don't want to confuse those. So you want to do them 5 days after your menstrual cycle is over. For women already in menopause, please just choose a day every month and get your breasts examined. How do you do that? Go on YouTube and check how it's done. Quickly, put your hands on your waist, looking in the mirror, see what both breasts look like. Look at your nipples, put your hands behind your head, look at what your breasts look like, and you can examine with the part of your palms in circular motion. You can lay down as well and do the same. Now, what are you feeling for? You're checking for lumps, checking for swelling, checking for rash, any abnormal redness or contour, any abnormal dimpling, any discharge of the nipple, any of all these changes. Please go to the hospital and get checked. That's for breast cancer. Second of all, I want to talk to women about cervical cancer. That's cancer of the cervix. Where is your cervix? Okay, so I did have this balloon inflated to demonstrate to us. Now, the womb, which is the uterus, is usually about the size of a fist. In a non-pregnant womb, it's this small. But in a woman who is pregnant, the womb can get this big and even bigger, right? Depending on what you're carrying. If you have twins or triplets. Anyway, so let's imagine that the womb sits right here, which is where it sits anyway. So the opening of the womb down here, the opening of the womb down here is what you call the cervix. This is all the womb, but the mouth of the womb is the cervix. Now, cervical cancer, the good thing about it, there's no good thing about cancer. The good thing about the information of cervical cancer is the fact that it's one of those cancers that can be treated 100%. And so this is possible when it's detected early, right? Because if it's still in the cervix, then it can be taken off and there'll be no issue to the woman. What do you use your cervix for after having your children? Pretty much nothing. So cervical cancer can be detected early. And what is the testing done? It's called pap smear. Now, pap smear is recommended in women 21 years and above. Basically, they do like a vaginal exam and take a swab of the cervix and get it checked. If there are any abnormal cells, then they just simply take out the cervix, and 100% it's cured. So pap smear, another testing can be done is HPV testing. HPV testing, HPV stands for human papillomavirus. Now, this is a virus that has been implicated in over 75% of cervical cancers, and that is why if you're able to test for this virus, then there's no treatment for it, but they can put close eye on you. You can be monitored more closely, so that way you can detect if there are any changes as soon as possible. So pap smear usually is done every 3 years, and HPV testing is done every 5 years. So whichever one of these tests that you do, if it is negative, it takes another 3 or 5 years, depending on which one you do. Fortunately, there is a cervical cancer vaccine. There's a vaccine against HPV, basically, called Gardasil. And this is widely available because as early as 2012, I've had people take the vaccine. I think I took it in 2016 or thereabout, yeah. So it is recommended for both boys and girls from the ages of 9, usually 10 to 2, usually 11, 12, but from these, as early as 9, you can get it actually. From the ages of 9 to 26, you can get the HPV vaccine. It is called Gardasil, right? And we usually would want it early because then we're almost sure that the child has not been exposed to it. So it is more effective when the person has not been exposed to the virus. And why do we say in boys? It's because HPV, human papillomavirus, even though it causes cervical cancer, it also causes throat cancer, anal cancer, cancer of the penis. And so both men and women can benefit from getting this vaccine. It is 9 to 26. I'll move on quickly to prostate cancer. Now, prostate cancer is in men, right? Because men have prostate. Prostate, most men, as you would imagine, as we grow older, the prostate enlarges. And that is why most of our older fathers begin to have issues with urinating, because the prostate enlarges. But in those situations, it's not cancerous. However, it can become a cancer. That is done for prostate cancer. It's called PSA, prostate specific antigen tests, because the prostate releases PSA into the blood, and this can be detected if it's too high or if the levels are going beyond normal. And that way, prostate can be removed surgically if there are any concerns, and it has no implications basically. However, if it becomes a full-blown cancer and spreads, then it's a whole different ballgame. As a matter of fact, I do have a family member who was diagnosed with prostate cancer 4 years ago. And when I say 4 years ago, it means that it's been treated, the person is cancer-free. Thankfully, it hadn't spread. Sadly, I do have a friend whose father has recently diagnosed with prostate cancer here in Nigeria, and they're going to be having surgery done, I think, next week. So which means it's actually quite common, more common than we know it. And so let's not be ignorant to some of these things. If you're a black man here, we are all blacks, I assume. For a black man from the ages of 50, it's recommended to have your PSA test done, a blood test that can be done, and every year can be done at a primary care doctor, and that way you can know what levels you have. If there's a family history, father, brother, uncle that has prostate cancer, they know that you can't wait till you're age 50. You have to check it sooner. Lastly, I'm going to talk about colon cancer. Colon cancer is unfortunately third highest cancer in both men and women, right? Yeah, it's the third highest cancer in both men and women. How do you screen for colon cancer? It's basically a test called colonoscopy, where a microscope is used to look into the intestine and see any changes or abnormalities that can be removed. Now, a colonoscopy, it's available in Nigeria, but it's a little bit expensive. It's probably at least 80,000. If not changed now, but about that price. Now, colonoscopy can be done every 10 years. If it's negative, you don't have to do it until another 10 years. But if you're scared or not comfortable with the idea of them using a microscope to look into your intestine, you can do the FIT test, FIT, basically giving your stool in a container and they check for blood and other cancerous cells, and that can be done every 3 years if it's negative. Colon cancer, I would want to remind us quickly what the risk factors are. Now, there are risk factors that you have control over, and there are some that we do not have control over. The ones we do not have control over are family history. The family history of colon cancer, that's not up to you. If there's any genetic changes or predisposition, that's not up to you. Increasing age, we can't stop our increasing age, right? We can't reverse growing older. We grow older every day, and that's also in itself a risk factor. We can't control those, but the ones we can control, smoking, top on the list. Smoking is implicated in almost every cancer. It's one common risk factor to every cancer. It has no benefit whatsoever. So if you smoke, this is your cue to please stop. Stop for your own health. And not just you smoking now, that's active smoking. If you also reside or beside people that smoke, if you have friends that smoke, you go to the pub and they're smoking beside you, inhaling the smoke, you're also smoking. That's called secondhand smoking or passive smoking. You are at the same risk as the person who smokes. So it's not enough for you to say, oh, I don't smoke. It's also, are you around those that smoke? You know, do you sit in there where they smoke? Beer parlor and all of those places, right? Smoking is top on the list. Heavy alcohol consumption. Medically, 2 drinks a day for a man, 2 bottles a day for a man, 1 bottle a day for a woman is what is recommended. But me and you, as Christ women, what are we now called to do? I mean, if you go to a wedding and they have to toast, you know, with a little red wine, yeah, that's okay. But I mean, I don't know of any benefit to alcohol. And please, the whole story of, oh, red wine helps against heart diseases and all of those, you don't need red wine to protect your heart. There are several other things that you can do to protect your heart. Red wine is not the solution, okay? And that's not the reason for us to indulge in alcohol. Back to the basics. Alcohol consumption. When you eat a lot of red meat, in Africa, when you want to eat swallow, evidence that you have money, you have like 6 pieces of meat in your bowl. What are you using that for? What are we eating all of those for? Children should be able to have the 6 pieces of meat, and you adults have 1 piece. But I know in our African household, the older ones have more meat and the younger ones have less meat. But anyway, let's cut back on our red meat. Okay, processed meat, sausages, bacon, ham, hot dogs, those are processed meats. We have to cut back on those because processed meat, they are heavy in a lot of preservatives, right? They will not got a lot of processing that makes them more inflammatory and more carcinogenic. Shawarma lovers, I love shawarma. Oh, it's creamy, of course. Put 2 hot dogs, put 3 hot dogs. Why? Why? I'm here to remind us or to tell us that we can do without the hot dogs and the shawarma, okay? If you have to. Yes, I mean, I'm not saying you should completely eliminate them. If you can, better, but you can indulge in them once in a while. But if you're shawarma every Friday, TGIF, shawarma every other week, you know, you can stay without the hot dogs. Basically processed meats, whatever forms you eat them, cut back on them. You can eat them if you would like, but cut back on them. Moderation is key. Another thing I want to bring to our attention, which is a burden research, is microplastics. Now, this is, please hear me, disclaimer. It's not been proven that microplastics cause colon cancer. However, there's been studies, it's been shown recently that there's been a heavy or a high level of microplastics in colon cancers. You know, when they take the tumor cells and check them in the lab, they see that they have a whole lot of microplastics. And so that has led scientists to believe that this may have some indirect or direct relationship to colon cancer. But then, before this research is conclusive, we have to do the needful. How do you get microplastics? We use plastics every day. Bottled water, pure water sachet, plastics to store our food, right? Some of these plastics have been sitting under the sun for a long time. When they are in contact with heat degrades these plastics and they release them into our diet, into our water. So if we used to have, excuse me, if we used to have bottled water sitting in your car under the sun for a long time, you probably shouldn't drink that anymore because that plastic is likely eroded into your water. Another common phenomenon which I'm also guilty of is microwave, right? And I use microwave a lot because when I go to work, I pack my lunch to work, I have to microwave it to eat it. Now, what kind of plastics do we use? What kind of dish do we use to store our food, right? If we use plastics like this one, the takeaways that we get in parties to store our food, and put them in the microwave, they're probably releasing microplastics into your food. We should begin to use microwave safe dish like this, silicone plates. Even written on there, it's microwave safe, it's dishwasher safe, it's freezer safe, it's food safe. Silicone plates, these are very resistant kind of material and do rarely degrade. We can also use ceramic, glass bowls. These are microwave safe dish. Okay. If you're gonna have to heat up any food in the microwave, use plates like this, bowls like this. Not with the plastic now, because this is plastic. Not with the cover, because this is plastic. But use this and use a microwave safe cover, a paper towel to cover your food, or you don't have to cover it if you're okay with cleaning. Use that for your food. Okay, so in conclusion, I hope we've been able to take one or two from this short health talk. I'll do a quick reminder again, a quick summary. We talked about breast cancer, getting your mammograms from the ages of 40, or your routine self-breast exam, just so you're familiar with what your breasts feel like or look like. We talked about cervical cancer, getting your pap smears done from the ages of 21, and your HPV testing, if you can. We talked about the prostate cancer in men, getting your PSA test done every year from the ages of 50. And if you do have a family history, get it checked earlier. Talked about colon cancer, talked about microplastics using microwave safe dishes. We talked about silicone plates, glass plates, and ceramic plates that are microwave safe. Okay. Lastly, just being active, right? Your lifestyle changes. Exercise when you can. You don't have to have a gym membership. You can use the stairs. You can walk. Staying away from sedentary lifestyle. Cut back on alcohol. Abstain if you can. Stay away from smoking. It's a no-no. Eat vegetables and fruits. Cut back on processed meat and all of that. I would have loved to take questions, but then if you do have questions, send them across. It was such a joy, a privilege, an honor to speak with my sisters. Thank you so much again, Mommy, for this opportunity. Until then, let's enjoy the conference, worshiping and praying. And remember, like Daddy would say, you will never go down.